Madam Chair, or Madam Clerk, if you don't care, call the roll, please.
Yes, sir. Senator Rocky Adams, Senator Carroll, Senator Douglas,
Present.
Senator Neal.
He's on his way. He'll be here in
Okay,
just a second.
thank you. Senator Nemus,
Present.
Senator Thomas, Representative Blanton, Representative Burke,
Here.
Representative Fleming,
Present.
Representative Lockett.
He's on his way.
Thank you. Representative Riley, Representative Sharp, Representative Stevenson, Vice Chair Howell, Co-Chair Storm,
Here.
and Co-Chair Bowling.
Here.
Thank you.
This time, I'd like to entertain a motion to approve the minutes from the July 14th, 23 meeting.
Second.
We have a motion, a second. All in favor, say aye.
Aye.
Any opposed? The minutes are adopted. At this time, I would like to make just a brief introduction regarding Committee Staff Administrator Mr. Hopman here, who's seated to my left. This is his last meeting with us, and I would like to thank him for his service to the committee, and he's done a stellar job, and so other members may have comments at this point or may want to wait until the end of the meeting, but I did want to thank you for your work.
Oh, thank you.
Yeah, and I'll make a quick comment. I've only worked with Mr. Hopman for I guess since January, really, maybe a little bit before then. But you've just been the ultimate professional. You have a job to do, and you do it well. And we are definitely going to miss your service to this committee and to the LRC as a whole. And job well done. And best of luck to you in your next adventures, I'll say.
Okay, thank you, sir.
Thank you. At this point, we'll jump right into the item number 3 on the agenda, the Kentucky Child Fatality and Near Fatality External Review Panel 23 update. Gentlemen, you have the table.
Good afternoon. I'm Jeremy Skinner, and this is Jacob Blevins. We're both analysts for the Legislative Oversight and Investigations Committee. And we are here today to present a brief summary of our most recent evaluation of the Kentucky Child Fatality and Near Fatality External Review Panel. For background, the panel was created by executive order in 2012 and codified the following year in 2013. The panel statute was amended in 2022 with the passage of Senate Bill 97. Among other things, that bill changed the panel's composition and reporting requirements. The panel's mission is detailed in statute. Per statute, the panel is required to conduct comprehensive reviews of child fatalities and near fatalities reported to the Cabinet for Health and Family Services and that are suspected to be the result of neglect or abuse. The panel is then to document its case reviews in an annual report, which includes findings based on those reviews, along with recommendations for system and process improvements. Statute also requires this committee to conduct annual evaluations of the panel's operations, procedures, and recommendations. Legislative Oversight staff completed 8 evaluations of the panel from 2014 through 2022 and focused on issues such as the panel's compliance with statute, its organization and autonomy, its budget processes and staffing, and comparisons to similar entities in other states. This year's evaluation focused on the panel's actions related to recommendations from our report last year, the continuing implementation of Senate Bill 97, and the panel's statutory requirements to submit annual reports. Our evaluation this year has 3 finding areas and 5 recommendations. Our first finding area focuses on the panel's actions related to issues that were addressed in our 2022 evaluation of panel operations. Our November 2022 report included 9 recommendations covering a broad range of areas, including panel concerns related to DCBS intake and internal review processes, medical community training, training and feedback regarding Senate Bill 97 changes, findings and recommendations in the panel's annual reports, the updating and implementation of the panel's data tool and analyst binder, and the panel's budget and expenditure processes. Our review this year found that panel members and staff have taken action related to all 9 of our recommendations from last year's evaluation. we are going to focus on a couple of areas that we addressed in last year's evaluation that are still ongoing. The panel is continuing its efforts to improve the technology that it uses for case storage, review, and analysis. In 2022, the panel revised its data tool with a web application called RedCap. This update was an improvement over the previous data tool because it included more analysis-friendly options such as multiple choice rather than relying too heavily on text boxes. Additionally, panel staff and members worked to create an analyst binder, which serves as the panel's data dictionary, in addition to being a step-by-step reference for analysts working on cases. The panel uses another program called SharePoint to upload information and records from CHFS to a secure online location. SharePoint is in need of an update, reportedly, and according to the panel, this upgrade will be costly and time-consuming. The panel is working with the Commonwealth Office of Technology and Justice Cabinet budget staff to explore software options. This may mean updating SharePoint and sticking with essentially the system as it currently is, or it could mean purchasing new software programs for case reviews. Regarding the panel's budget and expenditures, the Justice and Public Safety Cabinet interacts directly with the panel regarding its budget preparation and expenditures. For context, the panel is attached to the Justice Cabinet for staff and administrative purposes. In 2014, the panel, through the Cabinet, requested $420,000 in annual funding for panel staffing and operations. And this $420,000 was included in the 2014 through 2016 budget of the Commonwealth as part of the Justice Administration budget. Also in 2014, the panel and Justice Cabinet worked on a Memorandum of Understanding, which outlined the panel's budget and expenditure procedures. The MOU has not been updated since that time and is likely in need of an update to reflect current budget and expenditure procedures. In 2021, the panel worked with the Cabinet and submitted a budget request and was allotted $420,000 in the 2022 through 2024 budget of the Commonwealth. Additionally, expenditure budget authorities were established in EMARS for the panel. This table details the panel's expenditures from fiscal year 2015 through fiscal year 2023. As shown here, the panel has yet to expend up to the full $420,000 that were envisioned by the appropriations in 2014 and 2022. However, panel expenses have increased over the past 2 years. The bulk of panel expenditures are related to personnel costs. Staffing has fluctuated over the years, but it has typically consisted of 2 full-time employees and 1 or more contract analysts. The panel's budget request in 2022 included a request for funding for 2 full-time positions, a social service clinician 2, which is essentially another case analyst, and an epidemiologist 1. In its justification for additional funding, the panel indicated increased caseloads resulting from its recent collaborations with the Department for Public Health to encourage the referral of cases from local child fatality review teams. The panel staffing remained relatively unchanged throughout fiscal year 2023. However, in July 2023, the start of fiscal year 2024, the panel added an administrative staff member who will be shared with another office, the Office of Drug Control Policy. Additionally, the panel entered into a memorandum of agreement with the Department for Public Health for epidemiologist services, and the epidemiologist from DPH will assist the panel in analysis for its annual report. The panel is actively working with Justice Cabinet budget staff to prepare a budget request for the 2024 budget session. Our first recommendation, recommendation 3.1, is that the panel should continue to work with the Commonwealth Office of Technology and Justice Cabinet budget staff to explore options related to the software platforms that it uses to store, review, and analyze cases. The panel has responded to our recommendation and have indicated that they agree with it. Recommendation 3.2 is that the panel and Justice Cabinet should update the existing Memorandum of Understanding to reflect current budgetary and expenditure procedures. The panel agrees with this recommendation as well.
Senate Bill 97 was passed during the 2022 regular session and amended sections of KRS Chapter 620 and KRS Chapter 72. Specific changes were made regarding a number of areas, including the panel's composition, the deadline by which the panel must publish its annual report, The privileged nature of panel proceedings, records, opinions, and deliberations, and coroner notifications. Additional language was also included requiring the panel to identify agencies responsible for implementing its recommendations and to notify them as such in writing. Agencies are then required to provide written response back to the panel. A requirement was also added for law enforcement to request a test of blood, breath, or urine when a report includes a child fatality or near fatality, and an officer has reason to believe the child's supervisor was under the influence of drugs or alcohol at the time of the incident. Over the past year, the panel has taken action to implement these changes. Specifically, the panel has assisted with training for coroners and law enforcement, and it included recommendations in its annual report related to the training of law enforcement officers. Additionally, the panel notified and assisted appointing agencies in order to fill vacant panel member positions. It should be noted at this time that Table 2.1 in our evaluation shows that there are currently 6 vacant panel member positions. However, at the end of July, 3 new members were appointed to the panel. The panel has met its reporting requirements by determining and forwarding recommendations to responsible agencies from its most recent annual report. The panel's 2022 annual report included 21 recommendations, which were forwarded to recipient agencies on February 1st, 2023, which is the report's publication date. Only 10 of the recommendations received appropriate agency responses within 90 days, as required by statute. It should be noted that the panel received responses to 6 additional recommendations in late July from DPH and other entities within CHFS after the 90-day deadline. Tables 3.7 and 3.8 in the report provide additional detail regarding agencies that did or did not respond to recommendations within that 90-day time frame. The panel has no formal procedures to follow up with agencies that do not respond to the panel's recommendations. According to the panel, its members and staff have limited resources in both time and authority to follow up with agencies that do not respond. Recommendation 3.3 is that the panel should develop procedures to follow up with agencies that do not comply with statute. For example, these procedures could include the use of formatted cover sheets attached to the recommendations for agencies to complete for a more standardized follow-up process. If additional panel staff are needed to comply with the statutory changes, this should be noted in future budget requests. The agency partially agrees with this recommendation as stated in the report. They believe that the agency follow-up is important, but do not have the time nor the statutory authority to enforce recommendations. Finding Area 3 relates to the panel's reporting requirement. Staff found that the panel met its statutory requirement to submit annual reports consisting of case reviews, findings, and recommendations for system and process improvements. In past years, LOIC staff found that the panel's findings were often unsupported by the analysis the panel performed, and that the reports did not always present the information needed to link findings to data. Staff also found that the panel's past recommendations were not directly linked to its findings, nor were they consistently targeted, actionable, or able to address concerns in the findings. In 2021, LOIC recommended that the panel ensure that its findings are based on data and analysis in the report, and that its recommendations both address finding concerns and are targeted and actionable. A review of the panel's most recent annual report, however, indicates that improvements continue in these areas. For example, in the 2022 report, all 14 findings were based on data or analysis identified in the report. All 21 recommendations in the report addressed the concerns identified in the findings. All recommendations were both targeted and actionable. Table 3.9 in the report provides additional information on the panel's findings in its 2022 annual report. Although the panel's findings and recommendations have generally improved, the panel could better organize the information to make findings stand out more in their annual reports. LOIC staff had to thoroughly read the information prior to each set of recommendations to identify the critical condition associated with each topic area, as noted in Table 3.1 in the report. Recommendation 3.4 is that the panel should continue to ensure its findings are based on data presented in the report, and that its recommendations are actionable, targeted, and directly related to findings. The panel agrees with this recommendation. Recommendation 3.5 is that the panel should organize information in each finding area, so that each finding is clearly associated with corresponding recommendations. The panel also agreed with this recommendation. And that will conclude our presentation.
Representative Lockett has a question, I believe.
Yes, thank you, Mr. Chairman. I just have a quick question. Back on where you listed recommendation 3.3, you made the statement that the panel should develop procedures to follow up with agencies that do not comply. Can you tell me, or do you know why there are agencies that are not complying with the existing statute?
It is the first year we're doing this. The law passed last year, so there is a little bit of a learning curve. Obviously, we have to comply with statute, but we don't have a direct answer for why that may be. I suspect that it's just nobody's in practice with the process just yet.
Okay. Thank you.
I have a question to follow up on that. So what types of agencies and an approximate number of agencies would not be complying right now?
At this point, there's several factors involved because they're supposed to reply in writing within a specified time frame, 90 days. 10 of the recommendations, which doesn't necessarily mean 10 agencies, just 10 of the recommendations met those requirements. They did receive an additional 6 after the time frame, so in late July, so they've received the majority at this point, 16 out of 21. And the agencies are typically within CHFS, Department for Public Health, other departments in there. And there are some, like the Kentucky Board of Pharmacy, they're a little bit more outside of that than aren't under CHFS. But they overall did receive a pretty decent response, just not necessarily within the time frame desired. But
Thank you. Representative Burke has a question.
Thank you, Mr. Chair. I'm looking at Table 3.8 about recommendations that did not receive an agency response. And number 16 is listing the General Assembly, specifically saying that through the Judiciary Committee, we should be researching national legislative models pertaining to child access prevention and safe storage. Obviously, we're not an agency, but are we amiss? Do we need to respond according to the law that relates to this board?
yes, we're not. We haven't had any experience with that. We don't know exactly what the interaction was between the panel and those committees, so I'm not at liberty to really say what exactly happened there. So as far as that, I'm not really sure what the communication was, and that's kind of one of the reasons we have that recommendation that procedures should be in place, so that then there's at least a standardized set of steps to go through, whether it be follow-up calls, follow-up letters, something, so that at least we can say what the panel could say at that point. We took these steps, but no, as far as that particular instance, I'm not exactly sure what occurred.
Okay, thank you. Mr. Chair, may I ask one more question on a different topic?
Sure.
Thank you. You mentioned that 3 of the 6 vacancies had been filled in July. Can you tell me specifically which ones have been filled, and were those Secretary of State appointments, Attorney General appointments, or appointments by leadership in the General Assembly?
They were all Attorney General appointments. There were actually 4 appointments. We say 3 new ones because one was a reappointment, someone who was already on the committee. So yes.
Okay, thank you.
Thank you. I think we have some more presenters. Steve, is that correct? Thank you. If you could, when you get to the table, just identify yourself and any guests you may have with you.
Good afternoon. I'm Steve Shannon. I'm a member of the panel. I serve as the executive director of CARP. CARP has a seat. We've nominated people since the inception. I've served on the panel, I don't know how many years, 6, 7 years. Introduce yourself, please.
Good afternoon. Alicia Mahoney with the Justice and Public Safety Cabinet.
Go ahead.
Alicia Mahoney with the Justice and Public Safety Cabinet.
And Rebecca Norton with the Justice and Public Safety Cabinet Budget Office.
We don't have any profound response to the report. We think it's a really good report. I think, there's one issue that's hanging out. This is year 2. I figure it got mentioned twice. It must be serious. We will update our MOU solely because I don't want to come back next year and have to explain to Senator Thomas, my own senator, why we didn't update our MOU. So we will take action to do that. And what we did last year that we did not do previously, we go over the recommendations. We'll do the same practice again so everyone hears it. They all get a copy of it, but we do that recommendation step by step and what takes place so there's no surprises, so people know what's going on. I always like to tell people these are all volunteers who do this work, with the exception of the case analysts who go through the great details of what happens to kids, and Ms. Mahoney. We do now have an epidemiologist, so I think the recommendation reporting the data and reporting will be much better because we have access to expertise in that area. We have clerical support, which will help us remain on task and do our job seriously and pay attention, because we really focus on cases and not so much the administrative stuff. That's where the MOU kind of dropped for us. And I've told folks, I told Alicia that if need be, I'll do the MOU with my partner on the right, just so we have an MOU. I think it is important to know what the expectations, and we don't want to, not take that seriously. But overall, we concur. I think the real message for me is the work of the panel and what takes place. When I started, we met quarterly for about 5 hours with a fairly elaborate lunch. Since post-COVID, we are all virtual. We meet every month now, 4 hours for 2 successive months, and all day the third month. So we went from meeting maybe annually 20 hours to in the neighborhood of now maybe 16, 48, 64 hours. So our work has escalated. And I kind of do this work for a living, but we have people on this thing, on the panel who take time away from their everyday duties. People who do this every day. I didn't know there was such a thing as pediatric forensic medicine. We have 3 of those people, Senator Douglas, who serve on the panel. This is what they do every day. So we take the work seriously. I tell people, I said last year, my wife knows when it's child fatality day because it's, I come home a bit more tired than I typically do. So the work is seriously. We enjoy the oversight we get through this process to identify things we need to do better. Our job is kind of look at what's happened with kids in state custody and kids who get referrals from public health.
Let me cut you off just a second. I know Representative Blanton had a question. I just want to make sure if it's a portion of what you're talking about right now that he's able to ask that question now.
No, Mr. Chairman, I'll wait till the end.
Thank you. All right, thank you.
But we take the work seriously. We want to do it well. We look at a lot of cases. So this review for us, I think, is useful. It makes our work better. Just so you know, we've been doing this. I've been doing this for a long time now. Ms. Mahoney's been there from the beginning, I guess, right? Very soon. Close, 27. Anyway, substance abuse permeates our cases. A lot of cases involving individuals who have a history of substance abuse. A lot of cases of kids who take their parents' Suboxone, some medication-assisted treatment, just it's laying around and they pick it up and eat it. It's problematic. This past year, I think a big change for us is we're seeing, and this is referenced in the report, many more cases involving kids with diabetes. We didn't have those cases till really the last couple of years, who aren't managing themselves well, whose family isn't supportive of that management. Teenagers are hard. They don't want to do things that make them different necessarily unless they really want to, so they don't want to take insulin. They don't want to have those dietary restrictions. So I think that's a new thing we're seeing we had not seen before. We got to figure out a plan of safe care. We got a lot of situations where your young people have access to firearms in the home, and it's they're not secured, they're not put away, and bad things happen. I think this again is probably the most important work I do. I think it's really our goal is to identify patterns, activities, and maybe down the road, prevent some of those things, change the trajectory for some kids' lives of what takes place. But it's again, we're looking at kids who have died in state custody, kids who have been harmed by parents, paramours. I've said that before. Speak a little bit of French. Paramour means by love. There's nothing about love in the typical paramour in cases we see. There's not a lot of love there. So it's tough work. and I commend the people that do it every day. I'm glad we have an epidemiologist. I hope we can get our software upgraded coming forward, and maybe get another case analyst so we can, because they do the massive amount of work. They're going through documents after documents, police reports, coroner's reports, and we look at summaries primarily. That's it.
Representative Blanton.
Thank you. Thank you all for your response. Thank you for the LRC staff and their hard work. I appreciate the fact that you're making progress. You can't do things overnight. It takes a while to digest, figure out sometimes, well, what are they looking for here? What they're wanting, right? Because we can't read one another's minds. So it takes time.
Yeah.
And I think the effort has been shown that you're working to achieve what has been asked of you. And for that, I commend you. My question actually is going to go off basis of this, what we're here about today. But since we've got you here today, I don't know if you would have this information readily available, but when you presented to us, I believe last year, there was some numbers. We talked about the near fatality numbers and the fatality numbers for the past few years. And I was just wondering, since last year, what those numbers are looking like. Do you have that information?
It's in the report. If I pull it off, where is it?
I looked for it and I didn't see it.
There you go. 69 fatalities and 146 near fatalities. So 215 total.
Okay, 215 total. What was
Cases.
last year's, the previous years? Are we going up? Are we going down? Are we stabilized? That's the point I'm trying to
That's
get
a
at.
great question, and I wish I was better prepared, sir.
Yeah.
But my expectation is we're going up.
Okay.
And reason I say that is as you start collecting data, it's kind of what's going to take place. But yeah, I think it's been hard. But yeah, fatalities. So 215 cases, and that's the split. 69 and 146. 69 fatalities, 146 near fatalities.
Yeah. So, and that was what I was just trying to find out. Where is the trend going? Is it,
We'll get that for you.
Yeah.
And we'll make that available, and we'll go back last 5 years. Can you do that?
Yeah, that'd be great. Thank you so much.
Yeah.
And thank you all for what you're doing.
Yeah, it's good.
And I do believe there's some of that information on page page 17 in
I
chapter 2.
thought it was in here.
Looks like fatalities, it's starting in 2018, it's gone from 51, 54,
Yeah.
85, 80, 69. And then near fatalities, that same time period, 83, 82, 97, 120.
Yeah, fatalities dropped
146.
by 11, but near fatalities increased by 26. So, and these are the cases we get to, truthfully. Thanks for that, sir.
Senator Thomas.
Thank you, Mr. Chair, and thank you, Steve, for all the fine work you do. And you show up every day when we're in session to make sure that you stay on track and stay advised to everything that we do in the legislature. I see you every day, and I really admire your constant diligence there. I want to follow up on some of what you said. You've answered my question partially. But you indicated how your workload has increased, over time. And I remember when this panel was created by the previous Governor Beshear. And I remember all the horror stories we would hear in the state that led up to the Christians panel in 2013, 1 year before I actually came here. But you mentioned that part of the reason for the increased work that you're doing over time has been because of more diabetes cases involving children, and more paramour-related incidents between paramours of parents and children. Are there any other reasons, other than those two, why we're seeing increases in cases? Is it just those two? Are there any other significant numbers of types of cases that you didn't elaborate upon that are leading to this increase in fatalities and near fatalities of children?
Substance use. And I think that's, and that's a lot of the cases have that. I mean, a huge percent of substance use related. Parents, kids themselves ingesting, extended family using substances, some misusing prescribed medications, Suboxone's prescribed medicated assisted treatment, using that inappropriately. And it's just, many cases, multiple different substances people are using. It's just, it really is, it's pervasive. It's not a secret. I mean, we all know it. We talked about it, but it really is, we see it in many, many cases, what takes place.
Yeah, and I'll just add with the overdose and ingestion cases, I mean, those are skyrocketing. And historically, the overdose ingestion cases were typically near fatal cases, and now we're seeing more fatalities in these types of cases as well. So that's a big issue for us.
Senator Neal.
Thank you, Mr. Chair. Thank you very much for the work that you do. I'm looking through here, and I'm just wondering, is there any additional demographic information that's available that's not in this report?
Yes.
Where do you find that information?
Is it posted? It's in our annual report.
It
that
is?
we submit, and we can get you all copies of that as well if you want to see
Could
that.
you do that? That's
I think
that's
that
all
would
I'm
be a good bit of
seeking.
information we can provide to all panel members.
Just-
We collect, it's 4 categories of information on every case, and it's up to, I mean, how many variables is it? It's a lot. 200 something variables. So we have living arrangements, we have age, we have substance abuse, what it was. We have a variety of injuries, another one that comes up, and this is always baffles me. Blunt force trauma, and we don't know who did it. I'm a dad, got a wife, baby, 3 of us at home, blunt force trauma. The kids didn't do it themselves. No answer to that. I think it's really hard. So that's the type of thing that shows up. Motor vehicle accidents are reported. That shows up. So there's all sorts of data we can provide. Pretty much anything you could think of, we track, and then we make a recommendation. Was it preventable? Was it not preventable?
Well, and that's, if I may, and that's where I was going. It may be in this report, and you may have already referenced it. You give recommendations, or does it give you information that leads you to specific policy and our other types of strategies that
the
deals with the
recommendations
questions
that
of
are referenced in
preventability
here
and that sort
to
of thing?
other agencies comes from that data set. So cases that are new to us, things that we review and see, that's how the recommendations. We looked at a lot of cases over the last 2 or 3 years. Teen suicide or attempted suicide, and that's where there was a recommendation on psychological autopsy. And really, what happened? Was there something we missed? It's, I'm not a doctor. What I know about Senator Douglas can tell you. But you do an autopsy to find things out. This is a psychological autopsy. Can we identify in kids who have committed suicide what happened, right? So that's a recommendation we made. And there's someone said there's 3 of those people in the state who can do that work. But I think that came from the data that we saw in our cases, and every case we do an elaborate data report of what's captured, contributing factors, cause. We debate what was the cause of the injury, the near death or the death. So there's ample data.
Well, if I may, I'm sorry, I don't want to take it. And you may have just said it and just didn't absorb it myself, but there's certain data that leads to specific policy steps that should be taken or can be taken.
Yes.
That would lead to prevention.
Yes. And
Okay.
those are the things we send to different departments.
That's what you're saying to me.
Yes.
Okay.
Correct.
I got it.
And we had
Thank
21 of those this year, right?
Thank
And
you.
we'll have another report by February 1,
Yeah.
and that'll have recommendations as well.
Representative Stevenson.
Can I have one more last, if I may?
One more.
One more. I can't have 3 more. Just one.
I'm going to get to her, and then I can come back to you.
I'll come back. Fair enough.
Go ahead and ask your question, Senator Neal. Yep.
Did you determine, and maybe in this report, certain trends that would allow you to target where these things might happen?
Do we have location? Not as much, right?
Do you have that capacity to do that?
We've actually had conversations before, and people encouraged us not to identify, primarily, if I remember correctly, from criminal justice perspective. So we don't include that data of where it takes place. We have it by DCBS region.
Well, we have the county data in our report. We just don't specifically mention county names during our meetings. So it will, in our annual
Yes.
report, it does
And
break
come
down
talk
how many
with you,
of these
right?
Yeah.
Yeah.
Okay.
How many of these happen?
Thank you,
each
Mr.
year.
Chairman.
Representative Stevenson.
Thank you. Of the fatalities of children, are there any records kept about whether or not this was their first time in the system or multiple repeats in the system?
Very
and
much
where
so.
the failure was?
We identify previous history, whether, in my time, sometimes it's three generations of involvement with DCBS, So yes, we identify that. We do look at missed opportunities. We want to keep a positive relationship with DCBS, to be, participatory, collaborative with them, not accusatory. So we look at those missed opportunities, and quite often those will come up. This was a missed opportunity. There was a neighbor who said something afterwards in the investigation. They were suspicious of what was going on in that home. That was a missed opportunity for that neighbor to tell somebody beforehand that might have prevented it. Cases where there may have been a change in a key person in the family that didn't get handed off well. So yeah, we look at those missed opportunities and try to identify what those are to minimize and there's some number of those that we have.
Oh, missed opportunities?
Yeah.
Well, it's broken down by, so we look at if the judicial system had a missed opportunity, if it was a law enforcement missed opportunity, whether it was a DCBS issue, all that is broken down in our report.
A medical issue.
Or medical.
We've had people go to the doctors and that, the doctor doesn't make a referral to somebody.
And what is the definition of a near death?
That is certified by a physician. It's a statutory definition, and it has to be certified by a physician.
So it's not us doing it. It comes to us from the person in the hospital. They make that determination, and that then becomes a case we will look at.
Last one. And when you say blunt force and there was only the dad in the room, but we can't determine what happened to the
Well, there was
baby.
two people involved. You don't know when it happened. We do know it was a diagnosis afterwards, and we don't know necessarily what person was responsible, the responsible adult with that child at the time. And that's kind of, we just don't know.
And where do we do with that information?
It gets put down as, cause undetermined, right?
Well, it depends on the case. So a lot of these cases.
Pull your microphone a little closer, please.
Sorry. It really depends on the case. With some of these cases, the child may not be symptomatic until 24 hours later, and then they're brought to an emergency department, and the results are come in that there was a pediatric abusive head trauma. Then you have to go back and determine who was the child caregiver during the last 24 to 48 hours, and from there it gets a little confusing. You don't know if that child was at a daycare for half the day or with this parent. We do track lack of child care. And it's a problem. You have a kid who comes in with a pediatric abusive head trauma, and there's multiple caregivers within the last 24 to 48 hours. And that makes it really hard to determine who actually did the injury.
I mean, I know it makes it really hard, but kids have no agency and they depend on adults to do something to save their lives. So even though it's hard, do we do anything?
That is where we track missed opportunities. So in a lot of those cases, we would call, let's say if there was law enforcement involved, if they did not conduct a thorough investigation, we would call that a missed law enforcement opportunity. And that's where we would go back, and from a prevention standpoint, we need to increase their training. They really need to be working closer with medical providers to maybe try to develop a better timeline or interview and how they interview the suspect. So there's a lot of, we identify those systemic issues and then try to think about prevention and how to further improve those. So.
Thank you, Mr. Chairman.
Representative Bowling.
Thank you, Mr. Chair. And I do want to thank you all for your work. I can tell you take your work very seriously. It shows in your work. It seems like you all have just gotten better and better the last several years, and that's much appreciated on behalf of our state. Thank you. My question is on the education and training you all do. I know you reach out. I think it mentions the coroners in there, and that the Kentucky State Police are implementing this as well. What is like the scope of your training? Like who all do you reach out to? Local police departments? Is it mostly just the state police, coroners? And then what is the reception you all get on the training that's provided?
I will say most of the training that the panel does, it's on the members that are a part of this panel are the ones that take on that training. So for coroners, we have at least 2 members from the Department from Public Health. They take back what we talk about at the panel and they conduct the training. So it's not like we've put together the training from a panel perspective, but we do partner with those agencies to help them, conduct the training. Same with DOCJT. I will say that's where the difficulty lies with making some of these recommendations. Historically, they said we were not identifying responding agencies. We would make recommendations such as law enforcement in general. But when we're making a recommendation to a specific agency, let's say KSP or DOCJT on training, we're not including Lexington's training or Louisville Metro's training. So there are so many different entities out there that are available or potentially could benefit from these. And that's where we said we're just trying to continue to grow and develop. And, I really do think Jerry and his staff are really helping us along the way to try to get this developed and for legislative support on Senate Bill 97. I mean, I think that's going to be huge for us, just getting in and talking with these agencies.
Good deal. Thank you. And one more quick question. Budget question. Looks like $420,000 a year is what's been allocated. Many of those years that amount was not fully used. The unused funds, where did those go back to the Justice Cabinet? Do they go back to the general fund? How's that?
So any of the unused funds, I've only been with the Justice Cabinet since midway through 22. So I can tell you any of the unused funds from this previous year out of that 420 lapse back to the general fund.
Okay.
So if you're looking at our budget, you would see that remaining amount lapse back. We don't really anticipate that for this year. I think as they've mentioned, we've brought on, part-time administrative help, the epidemiologist through contract to assist with some of this, as well as some additional COT costs to kind of keep that SharePoint system up and running. So we think we're going to probably really strategically use all of that 420 this year.
Okay. And have you all already begun work? Have you started work on your budget request for the upcoming years? And do you have is it going to be an increase, stay the same? Do you have any idea yet where that'll be?
We've started work, and I've been at the last few panel meetings to talk about, what did we do last year, and what they would like to ask for in the biennial budget. And so we're working collaboratively on that. We have a draft, but it's definitely not going to be submitted without their input and approval.
Yeah, the software is clearly something that we want to see happen. We'd like to get another case analyst as well. I mean, either on contract or full-time. Those are the 2 things we've talked about as a panel that we think is important moving forward. You can only piece together software so long.
Yep. Very good. Thank you all.
Representative Blanton.
Thank you, Mr. Chairman. Permission just to comment on the conversation. So we're dealing with children, and children understandably affect us differently when these type of horrific events. Some of them are accidents. I get that, but and I know some of it was just examples being laid out, but for somebody who's been in the real world and the real experiences of these things, we do a lot of things in our laws. Quite frankly, I would suggest in the protection of those who are committing crimes that we don't think about until it's a child involved. But we're sitting here talking about an example of 2 adults, a mother and a father, and a child, blunt force trauma. We can't prove who did it. What does the laws tell us? They can interview them. They can't force them to take a polygraph. It's not admissible. They can't waterboard them, make them tell the truth. If they keep their lips sealed and don't say anything, and there's no physical evidence, how you going to prove which one did it?
Right.
You ain't going to find a prosecutor that's going to indict both of them and bring them before a jury and say, okay, you all figure out which one did it. That's not going to make it. That's not going to make it. And so we're talking about very unfortunate events, but we also got to look at our legal system and the way it's set up. Somebody ought to pay for the death of these innocent children. But when we do all this stuff, there's unintended consequences. And some of these things, this is unintended consequences that prevents us from carrying out the punishment for that child that didn't deserve that. Everybody did everything they could to try to prove it.
Right.
But again, we can't make them talk. There's no physical evidence. It happens. And then we get upset when we hear about a child and two people in a room. Somebody knows what happened to that child. One of the two knew, or they both were involved, what happened to that child. But we can't force them to tell us. And that's the world we live in, and that's reality. There's no blame to place on any of you all. There's no blame to place on the cabinet,
Right.
law enforcement. The blame goes with the one who did it, but we can't prove who did it, and we have to live with that. So every time we talk about criminal justice reform, every time we talk about these things that makes it easier for somebody to defend themselves against a crime, let's think about what if that crime was against a child, because we just made it easier for them to get away with murder. Thank you, Mr. Chairman.
Senator Douglas, question?
Mr. Chairman, may I also make a comment on the conversation?
You have a question as well?
Not really, sir.
Okay, go ahead.
I just want to thank you all for being here today and being in that seat. And no one appreciates what it's like being in that seat the way you all do. You know, we're looking at an issue here where one of the things we seldom talk about is citizen compliance. We talk a lot about system compliance, but we don't talk a lot about citizen compliance. We don't talk about the degradation of our family structures. We don't talk about the multiple child care providers. And we often don't talk enough about the multiple environmental and social issues that those child care providers and the pressures that those child care providers are having to deal with. And I just wanted to say that, you know, this is not a perfect system. And even if you had a perfect system, you couldn't resolve this because the system can only handle what the system has. The system doesn't deal with our citizen compliance. I just wanted to thank you all for being up here today. Thank you. Thank you, Mr. Chair.
Any further questions? I did have one question. Do you all have any sort of statistic or number of children who may have been removed from their homes and then placed back into the same home that either are a near fatality or a fatality?
We do not have that data specifically. We do, like I said, track the DCBS history, but that does not include, it doesn't break out how many times they've been returned to home and then back out of care.
Do you have, can you trace, though, whether or not that child has been previously removed and then?
Yes.
Okay.
Yes.
And that information, who is that shared with?
That's shared in our report for
Okay.
DCBS history, yes.
Okay. That may go back to what Representative Bland was talking about. If those individuals, those children have been removed and they're back in the home and now they've suffered one of these incidents, then perhaps there's some sort of evidence there that could be gathered. Any further questions? Thank you. I think at this time I'd entertain a vote to adopt the staff report. Make a motion.
Second.
We have a motion, a second. We can take a roll call vote.
Senator Rocky Adams, Senator Carroll, Senator Douglas,
Aye.
Senator Neal, Senator Nemus,
Aye.
Senator Thomas, Representative Blanton, Representative Burke,
Aye.
Representative Fleming,
Aye.
Representative Lockett,
Aye.
Representative Riley, Representative Sharp, Representative Stevenson,
Aye.
Vice Chair Howe, Co-Chair Storm,
Aye.
Co-Chair Bowling.
Yes.
So with a vote of 10-0, that is adopted and passes. No further business on the agenda. Entertain a motion to adjourn. Motion to adjourn is granted. Second. Thank you.